evening, and I'm Amanda Katzenbach with Mammoth Hospital, and today I'm going to be presenting you about the musculoskeletal system. The musculoskeletal system includes the muscles, bones, joints, and related structures such as tendons and connective tissues. All of these body parts work together to perform 4 primary functions. These primary functions are producing body movements, stabilizing body positions, storing and moving substances within the body, and generating heat. There are 2 medical professions that have to do with the musculoskeletal system. These are orthopedics and chiropractors, and they both have very important roles. Orthopedics are devoted to the prevention, diagnosis, and treatment of disorders of the bones, joints, ligaments, tendons, and muscles. They treat many musculoskeletal problems that occur in people of all ages, from newborns to elderly. These can range from anything such as sports injuries to osteoporosis and arthritis and tumors in the bones. Another medical profession is chiropractors, and they also treat disorders of the musculoskeletal system like orthopedics, but they are not allowed to employ drugs or do surgery. Instead, they use chiropractic medicine, which is the theory that most diseases are caused by pressure on nerves, and they try to relieve this with different types of therapy. Now here are some medical terms that are associated with the musculoskeletal system. The first one is arthritis, which is the inflammation of a joint. Next is articulate, which means the site of contact between 2 bones. And then contraction, shortening or tightening of a muscle. Musculoskeletal, pertaining to the muscles and the skeleton. Synovial fluid, lubricating fluid secreted by the synovial membrane within the joint. Ankylosis, this is the immobility of a joint. Muscular, this means pertaining to the muscle. Osteoclast, cell that breaks down bone. Myosarcoma, which is malignant tumor of the muscle cell. And then radiography, which is just an X-ray image. Now we have 3 diseases and conditions that follow the musculoskeletal system. One of the main ones that you hear about is arthritis, and there are many different types. But arthritis is just the inflammation and deterioration of a joint and joint tissues that can cause swelling, pain, and loss of mobility in joints. Some of the other types are osteoporosis, which is the immobility to move your joints and immobility to move bones, and that's where it mostly aches. And then there's rheumatoid arthritis. Next you have osteomalacia, which occurs when not enough calcium is deposited during childhood, and this causes rubber bones. This is also caused rickets. Next we have scoliosis, which is the sideward curvature of the spine that causes back pain, disc disease, and arthritis. And you can also do many different things, and there's many different surgeries that you can do to help cure scoliosis. There are 2 diagnostic procedures that go along with the musculoskeletal system, and these are arthrocentesis and arthroscopy. Arthrocentesis is the puncture of a joint space with a needle to obtain sample of synovial fluid, and this can be used for many different purposes, such as instilling medication, diagnostic purposes, removing fluid from joints, or just to simply relieve pain. And next is an arthroscopy, which is a visual examination of the interior of a joint using a thin, small needle, and which is called an arthroscope. And this has a miniature camera on the end, and it projects images to the screen so you can see what you are doing during the procedure. One of the medical/surgical procedures is an arthroplasty, and this is just a surgical procedure used to restore the function of a joint. A joint can be replaced in 2 ways, by resurfacing the bones or using an artificial joint called a prosthesis. In this picture, you can see the articular cartilage and then the normal joint space. And before you have an arthroplasty, there is very minimal joint space, and most of the cartilage in this specific joint has been lost. Next is total hip arthroplasty. This is the damaged femoral head is removed and replaced with a metal stem that is placed into the hollow center of the femur. The femoral stem may either be cemented into the bone or just, I don't know. And then right here is a picture of just how the procedure is done. And the last medical or surgical procedure that goes along with the musculoskeletal system is sequestrectomy. This is the removal of sequestrum, which is just another word to refer to as dead bone. The sequestrum must be removed because it can build up scar tissue, which can cause pain, and most medications will not work for this because there is very little blood flow to the dead bone, so they cannot reach. Some of the medications that go along is, the first one is bone reabsorption inhibitors, and these are used to reduce the absorption of bones when you have very weak or fragile bones, and this is usually when you have osteoporosis or Paget's disease. Next is gold salts, and this helps to treat rheumatoid arthritis, and it inhibits activity within the immune system to help cure the arthritis. And next you have muscle relaxants, which, as the word says, just relaxes your muscle and helps with spasms, pain, and stiffness. And then you have non-steroidal anti-inflammatory drugs, or NSAID, which is help relieve pain and reduce inflammation, and they can have a wide variety of things that they help, such as sprains and strains to arthritis and osteoporosis. Some of the abbreviations that you will most commonly see is FX, which means fracture, L1, L2 to L5, which is your first lumbar vertebrae, second lumbar vertebrae, all the way to your fifth lumbar vertebrae, MD, which is muscular dystrophy, CTS, which is carpal tunnel syndrome, MG, which is myasthenia gravis, NSAID, which is non-steroidal anti-inflammatory drugs, RA, which means rheumatoid arthritis, S1, S2 to S5, which is your first sacral vertebrae, second sacral vertebrae to your fifth sacral vertebrae. And then last is THR, which means total hip replacement or total hip arthroplasty. And thank you.